Eye on Health on Dubai Eye 103.8, delving into your overall well-being.
With MedLab Middle East, paving the way for innovation and sustainability in laboratory medicine.
I'm Helen Farmer. You are listening to Dubai Eye 103.8. This is Eye on Health, brought to you by MedLab Middle East and Arab Health. And we're talking COVID-19. Interestingly, years past I thought we'd be talking about this, and flu, because here in the UAE, and also notably very much internationally, a huge spike in flu cases. So what are the differences between the symptoms, the treatment? What are expectations for the future? We are speaking now to Dr. Hesham Ali, an ICU specialist at NMC Brovita in Abu Dhabi. Doctor, thank you so much for making the time to speak to us. I know it's a very busy time of year, January, lots of people coming back with coughs and sneezes and worse from their international travels. So I wondered, what's coming into clinic? What are you seeing in terms of COVID and flu and other nasties at the moment?
Thank you for giving me this chance to talk about this important subject. Actually, if we need to talk about the similarities and difference between flu and COVID-19, we can see both of them are contagious respiratory illness. There is different viruses. For COVID-19, it stands for coronavirus, SARS type 2, okay, which is first described at 2019, started in Wuhan at China. But for flu, it's caused by influenza viruses. And the first pandemic was started on 1918, okay, and it's called Spanish influenza. And there is also seasonal flu. Mm-hmm. Seasonal flu, it is not a pandemic, but it is increase of the peak of the infection and the number of patients, and it start from December until February and sometimes extend to March. This is called seasonal flu.
And can you tell us the difference between influenza A and B? Because I still feel like there's confusion between A and B. What do we, as the general public, need to know about that?
Every virus starts as unique virus, but with time and vaccination and infection, the virus gets mutation. Okay, so we have subtype, different types and subtypes of the influenza. We have influenza A and B, and even influenza A, if subtyped to H1N1 and H2N3, and we have B1 and B2. So this is different variant of the of the viruses, okay, due to mutation with time. Also, from the COVID-19, we have A, B, C, D, and lastly, we have also Omicron type mutation. Mm-hmm. And lastly, we face what is called Doomsday virus. This is also lastly started or described in China, okay, which is highly contagious, but fortunately, the symptoms is very mild.
So this is the latest variant that we're hearing about internationally, and as you rightly say, you know, China has it started there, and it seems to be ending there as well. Can we talk about symptoms of flu? Because I feel like I, at the minute here in Dubai, know more people with flu than I do with COVID, which, you know, I'm happy about, to be honest, because, you know, it's very manageable. So talk to us about the difference in symptoms, and I guess in the difference of the way we should treat flu as well.
Yeah. For the signs and symptoms, both sharing almost the same signs and symptoms, but of course, for COVID-19, the symptoms and signs will be more severe. We expect it to be more severe. So we have different group of symptoms. We have general symptoms like fever, fatigue, headache, body pain, or body aches. Okay, we have upper respiratory symptoms like runny nose, sneezing, sore throat, or loss of taste and smell. We have also lower respiratory symptoms like cough and shortness of breathing or difficult breathing. We have also gastrointestinal tract symptoms like vomiting and diarrhea. So regarding the symptoms, almost they are similar, but we need to do specific tests to differentiate between COVID and flu. Someone can ask me, can we get both virus at the same time? The answer is yes. And we expected the symptom to be more severe.
So what can we do to protect ourselves from flu? I've had a nasty cold for the last 2 weeks, but thankfully had the flu vaccine about 2 months ago. And I'm in no doubt that it probably would have developed into flu, or I'd been hit with a seasonal flu over the last couple of months. So flu vaccine, number one kind of course of defense. How effective is it?
Yeah. Vaccination, we'll talk about the vaccination, but first of all, we need to know the method of infection and the time of infection to understand how to prevent ourselves and our loved persons. So mainly it is respiratory tract infection, which is spread by droplet infection through coughing, sneezing, talking, okay? And also it is spread through contact touch. So if you touch infected surface, and you can transmit the virus to your mouth and nose. So this is the method of infection. For the flu, there is another infection from animals, but it is not reported to COVID-19. So for flu, infection can come from avian, from canines, from swines, from pigs. So we have avian flu, we have pigs flu, but this is not for COVID. So we need to take the standard precaution of social distances, wearing the mask, washing the hands, okay, isolation of the infected person. But the cornerstone for prevention is coming from vaccination. We have vaccination for both, for COVID-19 and for flu. And it is FDA approved for emergency use. For vaccination of the flu, we have nasal spray and we have injectable type of vaccination. And we recommend as a physician for everyone above 6 months to receive annual vaccination. And I highly recommend for a high risk group of patients or a person, anyone above 65, older than 65, anyone with underlying respiratory problem like asthma, anyone with immune suppression, anyone with cancer, anyone with underlying heart disease, anyone with a pregnant woman. All of this, we consider them a high-risk individual, because if they got infected, the symptoms will be severe and they will be very sick.
You mentioned there for
COVID-19, of course, we have different type of vaccination, but for flu, the difference, it is seasonal flu, so it is annually. But till now, COVID is not recommended to give in annually, only the basic standard precaution, standard vaccination, plus booster doses as recommended by our health organization.
It's going to be interesting to see how that evolves if we end up living with COVID-19 in the way that we've learned to live with influenza with an annual jab, responding to how that virus evolves over the course of the year. I'm sure you're going to be watching this with interest as well. I wanted to ask you a little bit about that flu vaccination, because as you said, those over 6 months, and we've had a bit of confusion about this. So people who are having the flu vaccine for the first time, such as young children, need to have 2 doses a month apart. Is that correct? And then once you've had that, you can just have 1 jab annually. Am I understanding that right?
For flu vaccination, it is once annually. This is for seasonal flu. But in case of pandemic, you will have 2 doses. But for seasonal, it is recommended to give 1 vaccination annually, okay, for every person, for everyone above 6 months, as mentioned, recommended highly for high-risk individual. Okay, and this vaccination must, what is this called? Quadrivalent. Quadrivalent, يعني including the 4 types of vaccination: influenza A, H1N1, and H2N3, and also B1 and B2. So including the most common variant of the influenza.
And for children, is it true that you need to have 2 doses initially? So my daughter had 1 and then we were told to come back a month later for her second dose because she'd never had a flu vaccine before.
Yeah, this is initially, but after that it will be recommended once annually.
Perfect. Also, I wanted to ask you about Tamiflu because I told a friend that I was speaking to you today and she had a question for you. So I hope this is all right. This is from Megan, who says, my 8-year-old has influenza B. It was confirmed by a test yesterday. Should their family then be taking Tamiflu as a precaution? She says none of them have had the vaccine, but they're going to now after seeing how unwell he is.
Also, one of the difference between flu and COVID. Okay, for flu, we have antiviral drugs treatment, which is FDA approved, but till now we don't have antivirus against COVID. Mm-hmm. For the flu, we have Tamiflu, okay, and it's recommended to give it as early as possible because this will give us better outcome, and also for the close contact of the patient, it's recommended to receive the Tamiflu.
So even if you haven't got any symptoms, but perhaps like Megan is living with somebody who has got some it's not even symptoms, he's been confirmed, could you still take Tamiflu as a precaution?
Yes. Because the person can be contagious and spread the infection even before the symptoms is clear. Okay. And the time for that, the time window for the flu, we can see from one day before the symptoms till 5 days. Okay. And for COVID, it is more extended. You can start 2 days before the symptoms up to 14 days. So a person can be healthy, no symptoms, and still having the infection and can spread the infection to the others.
And lastly, Dr. Ali, I wanted to ask your, predictions for 2023 when it comes to COVID-19 and influenza. What are you expecting to see coming into clinic? Dare I say it, in the media? What are your hopes?
We have to be honestly that COVID-19 is not finished. We're still having the COVID-19, but we have it with less symptoms. It is not, and we need to reassure the population that we still have COVID. It's not ending, but the symptoms is less, the risk is less, the death rate is less, mortality is much lesser than before. So in our hand, we have to take precaution if we have infected person as a standard precaution. And I think our health organization in UAE is very alert for any increase of the number, mm-hmm. and they take the proper action in proper time. They can increase or decrease the recommendation and precaution and testing the people or doing quarantine or whatever is needed. They are taking care of this.
And that's exactly right. We've never known more than we do right now. And, we're lucky enough to live in a part of the world that's incredibly well informed and agile and prepared. So thank you, Dr. Hesham Ali. Really do appreciate your time. Wishing you a happy and healthy 2023. Thank you so much, sir.
Much, and I wish you all happy, healthy 2023.
And thank you for tuning in to Eye on Health here on Dubai Eye, brought to you by Arab Health and MedLab Middle East. Make sure you tune in next week for another in-depth conversation on what you need to know about your health.
Eye on Health
with MedLab Middle East
on Dubai Eye 103.8.